Hey guys, welcome to MedTech. So in this video we are going to look at the pharmacology part of the pre-anesthetic medications. So what are the pre-anesthetic medications? Before we induce the person into the general anesthesia, we'll give a set of medications that help us in the general anesthesia procedure. So these are called as the pre-anesthetic medications. So what are these? These are the drugs that are administered just before the anesthesia so that the entire duration of the anesthesia is pleasant, safe as well as with no compromise. So these are the drugs that are administered just before the anesthesia so that the entire duration of the anesthesia is pleasant, safe with no compromise. So depending on an objective we give a pre-medication. So there is a set of objective and to meet that objective we will give a medication. So that is the pre-medication. So firstly moving on to the objective, that is to reduce anxiety and of surgery. So the patient feels anxiety of the surgery, right? What may happen in the surgery. So to reduce the anxiety, you will give benzodiazepines such as diazepam, lorazepam and midazolam. So what are they? They cause sedative, amnesic as well as a calming effect in the patient. They are also helpful in the reducing the anxiety, anxiolytic. So since we have a wide margin of safety is present in the benzodiazepines, they are used in the helpful in the reducing anxiety of the surgery. Then the next objective is to prevent vagal bradycardia, hypotension as well as to reduce the salivary secretion. So we'll have a stimulation of the vagus will lead to bradycardia resulting into hypotension and also to reduce the salivary secretion. So what we use? We use antimuscarinic agents called as atropine as well as glycopyrrolate. And what are they help? They help in the preventing laryngospasm as well as they reduce the respiratory secretions. So to prevent the vagal bradycardia, hypotension as well as the salivary secretion, we will give antimuscarinic agents, atropine and glycopyrrolate. They help in preventing the laryngospasm as well as reducing the salivary secretions. Then to relieve pre and post-operative pain. So whatever the pain is present in the pre as well as the post-operative pain, what do we give? We generally give opioids such as the morphine, pethidine as well as the fentanyl. So these are all the medications that we give to relieve pre and post-operative pain. Now what are the side effects of these opioids? That is the respiratory depression, hypotension, nausea, vomiting, constipation as well as the spasm. So along with the benefits there also comes effects. So we have respiratory depression, hypotension, nausea, vomiting, constipation as well as the spasm. So the next objective is for the antiemetic effect. For the antiemetic effect, we use metoclopramide, domperidone as well as ondansetron. Then the next objective, to prevent acid secretion and the stress ulcer. So to prevent acid secretion in the stomach as well as to prevent the stress ulcer, we use proton pump inhibitors such as omeprazole or pantoprazole. Then to increase the gastric emptying before performing an emergency surgery, we have to remove all of the gastric contents in the stomach and the colon and everything, right? So to increase the gastric emptying before emergency surgery, we use metoclopramide as well as domperidone. So we both know that both are the prokinetic drugs and they help in increasing the tone of the lower esophageal sphincter. Lower esophageal sphincter, they increase the tone and they accelerate the gastric emptying. So metoclopramide and domperidone. So these are the set of pre-medications that we use before the anesthesia. So let's revise it. To reduce anxiety and surgery, what do we use? We use diazepam, lorazepam, midazolam. To prevent vagal bradycardia, hypotension and to reduce salivary secretion, we use atropine or glycopyrrolate. To relieve the pre and post-operative pain, we will use opiates such as the morphine, pethidine, fentanyl. Then for the antiemetic effect, we will use metoclopramide, domperidone or ondansetron. Then to prevent acid secretion and stress ulcer, we will use proton pump inhibitors such as omeprazole or pantoprazole. Then to increase the gastric emptying before an emergency surgery, we will again use metoclopramide or domperidone because both are the prokinetic drugs and they help in increasing the tone of the lower esophageal sphincter as well as accelerating the gastric emptying. So thank you guys. Thank you for watching video till the end. Make sure to subscribe and hit the like button and share this video to your other friends, and also join our community in the channel description. Go to our channel, in the description we will have a community link, so join there to get access to these wonderful beautifully handwritten notes. So thank you and I'll see you in the next video. Bye.